The Waqatasq Elder Home has been 30 years in the making. After COVID delayed construction, it now faces another unexpected hurdle: recruiting 25 English-speaking professionals, like nurses, under Quebec's more stringent language law, Bill 96.
We've pushed hard to build capacity as a community, and this law may impose something on us that really challenges the capacity we're building and the services we want to offer to our people.
Listuguj is an English and Mi'kmaq-speaking community on the Quebec side of the Quebec-New Brunswick border. Quebec requires French proficiency to get a professional certification in most cases. Chief Darcy Gray knows the hoops to jump through firsthand. Before becoming chief of Listuguj, he attended university to become a therapist.
We have recognized therapists that can't come work in Listuguj because they didn't meet the standard of Quebec, yet they meet the standard of Canada.
In order to work in Listuguj without French, English-speaking workers need to live on reserve, and then their license is restricted to only practicing on First Nations or Inuit communities. They can't even live in Pointe-à-la-Croix, the town across the street from Listuguj. That's been the case prior to Bill 96.
Why is it that we would be, say, protected in our little community bubble, right, that doesn't apply? So maybe I could be recognized here, as fully meeting the standard, but I walk across the street and I no longer meet that standard.
Bill 96 now requires professionals to not only prove French proficiency, but to maintain fluent French to the government standards if they wish to practice outside of English-speaking reserves. Donna Metallic, Listuguj's health director, thinks this could discourage English-speaking professionals further from working in Quebec.
Before COVID, there was a shortage, and now COVID happened. So now there's a real shortage of professional people.
Bill 96 also further limits requiring English for employment and using it within the workplace. Metallic fears that this will exacerbate the lack of English documentation Listuguj receives from the health ministry.
Most of the documentations that our clinical team receive now is all in French. So we do have staff here that can translate, but we have to be very careful in the translation. And it shouldn't be like that. The ministry should understand that we're an English-speaking community. There's 10 in the province. I don't know if they know that we still exist out there. We're here. We're not going to go anywhere.
She said that the health ministry needs to sit down with English-speaking First Nations to hear their concerns.
Quebec, they have France that they can go back to. We don't. We just have ourselves. And we're revitalizing our language, and it's the first language of our people. So that they should be taking that all into consideration.
Emilia Fournier, APTN National News, Listuguj First Nation, Quebec.